My name's Sanjay Gupta. I'm a cardiologist in York. Today I wanted to do another video on marketing tricks employed by the pharmaceutical industry to make their medications more sellable. This particular video is entitled Short Trials, Long Prescriptions. So as you know, there's a real focus on evidence-based medicine. We should be practicing medicine that has an evidence base behind it. So when we recommend a medication, that recommendation is usually based on the fact that a clinical trial was done and the medication was shown to be beneficial in terms of either improving length of life or quality of life. But the truth is that most trials that test drugs do so for 2 to 5 years. But many of us who are prescribed those drugs end up staying on them for decades. Now, the problem with this is that if we're going to be evidence-based, then that evidence base is only valid for the duration of the clinical study. So if we find, for example, we give medication A, and at the end of 3 years, at the end of that trial, we find that more people have lived, then the truth is the validity of that evidence is only for those 3 years. It would be an assumption, and maybe perhaps an incorrect assumption, to say that that benefit will continue beyond that 3-year period, because we don't have the evidence for that. What we should then say, okay, well, if it's been shown to be beneficial at the end of 3 years, maybe we need to do a longer study and show that it is still beneficial after 10 years or 20 years. But that never gets done. So the trial tests the drug for 2 to 5 years, but then there is this assumption, people extrapolate and say, oh, well, it worked at the end of 5 years, so we should just take it for life. But the problem with that is that we're not the same person 10 years down the line. You know, our metabolism has changed, our comorbidity has changed, we've grown older, our priorities in life have changed, and how we tolerate side effects has changed. So we are not the same person that was once prescribed that medication. And therefore, I think it's really important, if you've been on a tablet for years and years and years, for you to ask, how long was this tablet actually studied for? Because beyond the trial, we are guessing. We're not evidence-based. And at that point, it's very reasonable for the patient to turn around and say, well, I've taken it for 3 years. That's what was studied. That was what the clinical trial was. So whatever benefit I was supposed to gain, I've gained that. And beyond 3 years, unless there is an evidence base, I can't see a good reason why I should continue this medication. Because you see, as you get older, for example, you develop other problems, and then the medication list goes up. And before you know it, you're taking a whole raft of medications, some of which are unproven beyond a certain time period, but you still end up taking them because you're just assuming that it'll be beneficial. And polypharmacy is a huge problem, and it harms in many ways. And therefore, it is very important for patients as they get older to start looking at their medication list, simplifying the medications, taking away those that do not have an evidence base, so that they can continue just to concentrate on taking the ones that are actually improving their quality of lives. So I hope you found this useful. I'd love to hear your comments. Once again, thank you so much. All the best.